Hey there, in this short video I'm going to briefly discuss what is a hair transplant. But first, let's discuss what it isn't. It's not this. And it's not this. And it most definitely is not this. At the most basic description, a hair transplant is a minimally invasive surgical procedure where we remove strong, healthy scalp hairs, usually taken from the back and the sides of the scalp, and move them to treat areas of balding at the frontal, top, and/or vertex. And the reason why hair transplants work is that the hair that is moved is genetically resistant to the hormones that cause genetic pattern hair loss. It is the most effective and reliable treatment that can give natural-looking results in individuals who are candidates for this procedure. A hair transplant has several stages, and the first is the design and planning. This is where the hair surgeon will determine the best approach for the procedure, taking several things into consideration. This includes your age, the hair donor density, the size of the balding area that needs to be treated, the characteristics of your hair and skin, the immediate hair restoration needs, as well as the long-term hair restoration goals. The surgeon will then design a hair transplant that will best complement your facial features. The hair transplant procedure has several steps itself. The first is anesthesia. A hair transplant is performed under local anesthesia, which means a numbing medication is injected into the scalp so that there is no pain during the procedure. The next step is graft harvesting, or the collecting of the hair follicles, and this is done using one of two methods. The first is the strip method, in which all the hair to be transplanted is extracted at once by removing a thin, narrow strip of hair-bearing scalp. The other method uses a small dermal punch, in which each individual follicular unit is extracted one by one. Then we move on to the next phase, which is graft preparation. Under a microscope, if the hair was extracted or harvested using the strip method, the strip is divided down to smaller units, all the way down to the individual follicular unit, which is ready for transplant. If the hair was harvested using the punch method, dermal punch, each follicle that is harvested is assessed under a microscope for viability and suitability for transplant. The next step is closing the donor area, and this only applies if the strip method was used to harvest the grafts, and this is where stitches or surgical staples will be used to close the donor area. The next step is graft preparation, and this is where tiny incisions are made in the balding areas to be treated using a microsurgical blade that has been cut down to match the size of your particular follicle. And this is where the strong, healthy hairs that were separated during the graft preparation phase will be placed. In the final phase is the recovery and growth phase, and after a short recovery period, you can resume normal activity and lifestyle. If you had stitches or staples placed, those would have to be removed in 10 to 14 days. During the recovery phase, the hair follicles that were transplanted are well anchored in the scalp. However, after a couple weeks, they will begin to shed the hairs. The follicles will then go into like a dormant phase, which lasts about 3 to 4 months, after which the hair follicles begin to wake up and the hair will begin to grow anew again. A hair transplant doesn't require any special maintenance, daily lotion applications, or daily pills. They are permanent and will continue to grow naturally throughout your life and can be treated as such. A hair transplant will not only transform your look, but can transform your life. Thanks for watching. Please like, comment, and subscribe.